Hello again, YouTube. Fitzy Fading here for my second video. Just kind of updating everybody on what's happened thus far. I had my endoscopy done today to check to see if I had a hiatal hernia. The only way I'm going to be able to have the gastric sleeve procedure is if I did have the hiatal hernia. So it was very excited to have the procedure, but a little nervous to see what they were going to find or not find. But I'm happy to report that they did find a hiatal hernia. So the surgery is going to be on August 17th. While I was having the procedure, I got a phone call telling me that I also have to have a sleep study. And thankfully they called me today and there's an opening tomorrow. So I'm going to get that taken care of. So that I don't have anything else standing in my way. The endoscopy was super simple. Got to the place about 8:30. We got there early. We're supposed to be there at 9. Check-in was super fast. They took me back about 9:30 and did the questions and putting on the gown and the IV and all that. I think I was taken back for the actual procedure. Want to say it was close to like 10:15 or so. There was a lot of people having the same procedure prior to me, so it took a little bit to get me in there, but it was very quick, no pain at all. They did take a little biopsy to check for some bacterial infection, and I'll get the results of that in a couple of weeks. All that means is if I have that, then I have to take an antibiotic, so not a big deal. Recovery was super quick. I was smiling the whole time and went home, left about 11:30. I think it was about that time. I did feel a little groggy in my head. I usually do after anesthesia, so I just slept, took a nap. It was fine. But I was very pleased. As I mentioned in my comments, I am using True Results in the Dallas-Fort Worth area of Texas, and so far they have been great. They do give you the choice of a couple of different doctors. I chose Dr. Nicholson to do my surgery and have yet to meet him. Have not been thoroughly impressed with his office. There's been some discrepancies between the paperwork that they give me, which is this like huge stack of all this information of what you can and can't do, and then this one, which is the pre-op diet, which talks about like what you can eat and for the 2-week prior to your surgery. Well, there was some discrepancies between what I got and what they had on their website, and I wanted to talk to somebody at the Nicholson Clinic to find out exactly which route to take, and they wouldn't talk to me. They said that I was True Results patient and I need to call True Results. Well, True Results doesn't know what the Nicholson Clinic, you know, that they had different things on their website versus what they gave us, and so they're just like, well, just do what you got on your paperwork. And I just felt like nobody really wanted to give me an answer as to why the Nicholson Clinic treats their own patients completely differently than what they do the True Results patients. And it was just something simple, like Dr. Nicholson's website says that they have to order this 2-week kit. That you have to order it from this website and you have to use this kit for 2 weeks. This mentions nothing about the kit. So I just wanted to know if I need to order the kit or not. And then the other big discrepancy was my paperwork says that this is a procedure where you leave. it's an outpatient procedure. And Dr. Nicholson's website says that sleeve patients stay in the hospital for 1 to 2 nights. Well, that makes a big difference, especially when you have kids involved at home. You know, I need to make sure that I have everything taken care of, and nobody will talk to me. So I asked my nurse today after I got out of the procedure, and she was super nice, and she has dealt with Dr. Nicholson's clinic with multiple patients, and she basically told me that what's on his website is kind of outdated, because he used to send patients to the hospital and make them stay a couple of nights in the hospital. He doesn't do that anymore. He has since learned that patients do just fine being sent home. He also used to do this drainage bulb thing. He doesn't do that anymore. They do some stitches inside, and he's learned that he doesn't need to do that drainage thing. She wasn't sure about the pre-op diet thing, but she did give me a list of protein shakes to try that were on the more approved list versus just going to the store and just being, you know, on my own. So I was happy about that. She answered a lot of my questions, and she told me that now that I'm through this procedure, I'll start talking to some more knowledgeable people, because all I was really getting was the front desk people that don't really know anything. They just answer the phones. So that made me feel a little better. So that's kind of where I stand. Tomorrow I go for my sleep study. Never had one of those before. My husband has. He told me good luck. I am going to be actually really excited, because it means I don't have my children to put to bed or deal with in the middle of the night. So that'll be a plus for me. I don't want to be woken up at 5 o'clock in the morning, but oh well. Let's see what else. I think that's it. I start my pre-op diet on August 3rd, and I think it'll be alright, because I've already been practicing. And as you can tell, I lost 15 pounds. So, yay me. Let's see. I think that's it. So I'll check back with you guys, I guess, starting August 3rd. Because I'll probably be ready to eat this phone by then. So, would love some support and encouragement from anybody who happens to catch this video. If not, and you catch this video years from now, hopefully I'm a much skinnier version of myself. And talk to you later. Peace out.